was first diagnosed with stomach cancer. I was obviously in a lot of pain. The pain started building up. My stomach actually exploded, and the cancer had actually grown and punched through my stomach walls.
The main treatment modalities for stomach cancer are chemotherapy, surgery, and radiation therapy. Often the best approach is the use of two, if not all of these treatment modalities simultaneously.
The first thought that comes to your head is when you hear cancer, you think of death. Now, in the previous hospital, when I was diagnosed, despite my husband telling the oncologist at that private hospital that these drugs will not work because we were told by pathologists which drugs will work for me. She refused to listen and she put me on the drugs that were not meant for me. 8 rounds of chemo, it didn't work. So I think at that point I became very devastated.
Depending on the stage and type of gastric cancer, the disease can be surgically removed. For disease in which there is spread to other parts of the body, chemotherapy can be used in conjunction with targeted therapy.
This time around, ever since I became a patient of Dr. Ng, because of the drugs that she's put me on, which is the absolutely correct drugs and the most fabulous drugs, because I just went for a PET scan and things are looking up for me. You know, I've done really well.
I feel very comfortable because she has a very good listening ear, and she tries to pick up on a lot of these symptoms to offer solutions to the patient.
Targeted therapy is a therapy that zeroes in on cancer-specific genes and proteins that are integral for cancer growth and cancer survival. In this way, targeted therapy can block the growth and spread of cancer cells whilst limiting the damage to healthy cells.
I realized that her services actually benefit wider range of patients. I was also very impressed by the excellent nursing staff, the oncologist staff that they have in Oncolife.
Targeted therapy in gastric cancer can also block angiogenesis, which is the process of making new blood vessels. Because a tumor needs nutrients to be delivered by blood vessels, the main aim of anti-angiogenesis is to literally starve the tumor and limit its spread to other organs.
I still continue to play tennis with my husband. We go out. We have a very big social life. I see my friends. I go out once a week with my friends. Nothing has changed. And it doesn't stop me from going out and doing what I used to do. Nothing has changed.
The most satisfying aspect about treating my patients is seeing how well they have responded and seeing my patients experiencing a clear improvement in their cancer symptoms and quality of life.